Super. So again, thank you for joining us today. I would like to begin by introducing Chantelle Ottenbreit to say a few words. Chantelle is the chair for the Alberta Elder Abuse Awareness Council, pardon me. So Chantelle, if you wouldn't mind just saying hello.
Sure. So, welcome everybody to our session today. We know that this is summer, and sometimes summer can be really difficult to get people out and to different sessions, but we really felt like we wanted to take the opportunity as this core elder abuse group, just really to celebrate some of the work that the CCRs have been doing across the province and give just a moment to be able to spotlight that important work that's going on. And so, we are hopeful that you'll enjoy today. You'll maybe learn a few things or at least be able to celebrate along with us. And so, we just are so grateful that you've chosen to spend your time with us this morning, and we look forward to engaging with you throughout this presentation. So thank you for joining us.
Thank you, Chantelle. I appreciate that. So we'll start with Chantelle will help me with this. We'll do a little short, just a one question poll to get a feel for today's participants and what they know or where they are in terms of a coordinated community response. So the question is, are you or have you been a part of an Alberta Coordinated Community Response, CCR, to address elder abuse? And so so everybody here uh, is involved in some way. So that's fantastic. So this is a real,
I have to be honest, this just had its own timeline. So I apologize if you didn't get a chance to respond. This just shut itself off. This is my first time doing it. So apologies if you didn't get to, but yes, it looks like everybody is part of a CCR.
well, and if you aren't, this is a great opportunity to learn about what this is about today. I'll start. I'll start. Oh, are we getting this poll?
There. I think it's done. Sorry, everyone.
No problem. So first we'll just go and I'll just kind of give a quick overview of our agenda today. So we have, of course, we've done the welcome, the introduction to the CCR, and I will just give you a little bit of an overview just to get us started there. And then we'll have our panelists oh, uh, that will share some information about today's uh, participants. Sorry, I've lost my train of thought. That's okay, I'll get back to it. And then we're going to have Lori. She will do a little bit of our CCR toolkit and some evaluation results. And then we'll have Chantelle back to just do some AAC current support, so the Alberta Elder Abuse Awareness Council. And then finally, we'll have some questions and answers from the panelists. We thought we'd leave that to the end, but at any time, you're welcome to put any questions in the chat box. And do I take that off there? Oh, sorry, that was me. I just still had the poll up there. So, and then we'll do a quick wrap up. So let's get to it. So we can go to the next slide. So this one, I just wanted to give you a quick overview of what the what and the why of the CCR before we have our panelists start. So a quick explanation of what a CCR is. A coordinated community response is based on collaboration between multiple organizations, service providers to ensure all key service areas related to identifying and corresponding to elder abuse are linked. And so why did this come about? And so back in 2015, there are some more stats that are coming up, and Lori will share those with us. But at the beginning, as the senior population in Canada continued to expand, the issue of elder abuse has emerged as an increasingly important issue. Family Violence in Canada 2015 stat profile showed that of the 10 provinces, Manitoba, Saskatchewan, and Alberta had the highest number of senior victims of police reported family violence. Additionally, these stats concluded that overall, the rate of family violence against seniors living in more rural areas was higher than those living in more of the urban areas. And of course, what is elder abuse? I'm sure that you're all aware of what elder abuse is, but for the purposes of this presentation, I have used the definition from the Government of Alberta webpage. Elder abuse is any action or inaction by self or others that jeopardizes the health or well-being of an older adult. Common forms of elder abuse include financial, emotional, physical, sexual, neglect, and medication. Of course, there are tons more, and we'll be speaking of that later on. So let's go to slide 4 and we'll get going. So this is where we want to celebrate all the good work of the CCRs. We have 4 panelists here today to share their experiences with you. We have Irene Fitzsimmons from Healthy Families, Healthy Futures. We have Debbie Posey from the town of Okotoks, Teresa Sutherland from Stop Abuse and Family Society, and Colleen Lewis, who will be talking on behalf of the town of Sylvan Lake for Brittany Wells. So we'll go ahead and start with Irene. Irene, if you wouldn't mind. Sorry, I'll just give a little bit before we get, sorry, Irene, I'm just gonna, so in preparation for this presentation, so if we can go to slide 5, we send our panelists 3 questions. The purpose of these questions is for our region's represented to give a bit of a background to the work that has been done in developing and collaborating amongst the organizations and service providers and to where they are now. Of course, there can be challenges, and for our participants who are in the process of developing their own CCR, knowing what those challenges might be could be helpful. The successes or sharing of stories is where we want to really highlight all the amazing work that has been accomplished to date, and we want to celebrate those accomplishments. Each panelist will have about 10 minutes to talk about their program using the 3 questions. And to our panelists, the questions are just a guide to help with the conversation, and please feel free to answer them in any order you wish or however you would like to speak on them. If you have any questions during the panelist presentation, please type it in the chat box and tell us who the question is for. We will wait until the end of the presentation for the question and answer period. Charlene, again, is monitoring the chat box to make sure we don't miss any questions. So Charlene, or sorry, pardon me, Irene, take it away.
Well, good morning, everyone. Really nice here, and I think it's a lovely opportunity to share just a few stories and a little bit of experience from rural remote Alberta. I guess I want to start by saying none of what I've worked on or developed with our advisory groups is new, in that my 3 CCRs that were developed between 2015 and 18 through the Taking Action Against Elder Abuse grant were built on the backs of those who came before me. So, you know, the Edmontons, the Calgarys, Medicine Hat, Lethbridge, Red Deer, Camrose, St. Albert, you know, people that had already done CCRs. So I want to give credit where credit is due. Much of my start was learning from those people who had come before me. And secondly, just I want to thank the core elder abuse prevention group for thinking of talking about this subject. I think it's timely and a good chance for us to connect. So why is the first question, and just if for those who know me, I'll probably go between all 3 multiple times, so don't try to stay on track with me, but hopefully it'll make sense at the end of it. So the 3 CCRs that were developed during that time, I developed 3 separate ones with 3 separate community advisory groups in 3 separate larger areas of rural Alberta. One was Athabascan area that included Colleen Lake, some of the Métis settlements, on and off reserve in Colleen Lake, some of the surrounding towns and communities, and Westlock and area as well, and Barrhead and area, including Fort Assiniboine. So although they're 3 rural communities, the counties, the towns range from, you know, about 3,000 in Athabasca, about 4,500 in Barrhead, and about 5,200 in Westlock. The surrounding counties and communities of different populations, which I'll talk about a little, make up probably around 8,000 to 9,000 in each, or, you know, 9,000 to 10,000 if we kind of shade those boundaries a little in each of those CCRs. So the reason, why is it important and why three separate instead of one regional? And so when the first thing I want to say is this was really all about relationship building for me. And the CCRs ended up being really about relationship building. For me to build relationships, I knew a lot of the service providers. I knew a lot of the senior centers and people within, but it was the relationship building to promote why is their participation important? Why is it critical for them to step up, to join the community advisory groups? And I also had a larger group across the region that met twice a year that pulled in kind of a broader group of people that may not have sat on the community advisory group in each of those three communities, but were stakeholders. So I met with each of the community advisory groups about once every couple of months or once a month, depending on the time and what was on our agenda. And then about twice a year, I brought a larger group of about 100 between, it started with 100 and it would range from about 80 to 100 over those 3 years that would get together either virtually or in person. We would have a gathering of probably about 60 people, between 50 and 60. And at that time, I'd always invite Lori and some reps from the seniors and housing ministry, because for our population, our people that had participated, it was critical for them to feel that they had a voice separate from me, that represented their own communities, and that they had the ability to talk to government reps about what was important to them. And so those once to two times every year allowed that opportunity to happen. And for that, they were very appreciative, and I know it made a difference for their participation, continued participation over time. I think the reason it was important also was because there were lots of similarities across those three broad geographical regions, and there was a lot of also disparities. And so it was a chance for the community champions, if you will, of elder abuse prevention to acknowledge where they had similarities, but also to respect and recognize where there were disparities. And I'll give you just a couple of examples. And so demographically, we often think of rural, remote Alberta as maybe kind of the same, and it really isn't, even across the region I represent. Barhead, again, with Fort Assiniboine being close and actually being quite a part of their service provision model, and also Neerlandia, which is a Dutch settlement. And so we worked with that group quite differently. In Westlock, the demographics there become different. There's a large number of seniors, and they have a different spectrum of service than the other two communities, Barhead and Athabasca, because they're closer to St. Albert and Edmonton, and more seniors tend to retire there, tend to end up in Westlock, because whether it's a chicken and egg, I don't know, but they have staged housing. In the other two communities, there's a real need for staged housing, especially in Athabasca. Most seniors have to leave their communities to find housing as they age that's appropriate if they need to. And so Westlock had a whole other demographics and actually different kinds of services available that the other two communities didn't. So their needs were different. And then Athabasca serves, we have quite a large Indigenous population that both accesses services within Athabasca, but also that I outreach to. On and off reserve in Calling Lake, Buffalo Lake, Métis settlement, Wabasca. So we also have a Native Friendship Center right within Athabasca. So they were critical in being part of our stakeholders group. So again, those are some of the disparities. The similarities were none of those three large geographical areas had public transportation. So when we as community come together and we start to hear, systems being set up, strategic planning being set up, I won't say most, but a large majority of people that I spoke to over those 3 years say that they tend to step back. They tend to not feel that they're included because, gee, we don't even have public transportation. So it allowed in us creating our own CCRs and models that represented both the similarities and diversities. It allowed us to speak a voice that included, we don't count on public transportation. We don't count on having staged housing available to all. We don't count on internet and technology being available across the regions that these CCRs represented. So it allowed a unique voice and it allowed them to stay engaged because it represented their unique needs. I think in terms of stakeholder participation, I just want to highlight, because I assume, maybe I shouldn't, but I'm assuming most of our stakeholder groups in terms of the direct 12 to 15 that sat on our community advisory groups may represent similar to what Teresa or Debbie may talk about in terms of RCMP, mental health, addictions, Alberta supports, senior centers, those kinds of individuals and organizations. For us, well, PCN, Alberta Health Services, who we included that was critical to our rural remote picture was service groups. So Rotarians, Lions, Elks, sounds like I'm doing a little bit of nature walk here, but the service groups that were critical, not only in their participation and distribution of information, but what became critical was the combination of my ability to present the It's Not Right, Neighbors, Friends, and Family as part of the awareness piece. Not that it was a major part of the Taking Action grant, but my own organization knew quite quickly that the awareness for elder abuse wasn't there when we started in, and so supported me in being able to participate in and facilitate about 25 sessions over 3 years across those 3 communities. And so the senior centers, the service clubs were critical in bringing the public together and their own participants to hear of those presentations and to become more aware and educated on elder abuse even to start. As well, the churches, the faith communities in rural remote Alberta, extremely important. Banking, and it wasn't that we could, what I tried to do was mirror each community so that I invited the same participant groups. So if it was a service group, whichever service group, if it was a bank, whichever champion of elder abuse prevention would be in banking in that community. Children's services we included, because we found with children's services pretty quickly that they described, as they became more educated along with us around process and procedure, that often when they went into homes if they had to go in and actually do an intervention or apprehension, many times in our northern community, especially in the Athabasca North, they would see seniors or elders in those homes, and they never thought to ask if they were safe. They focused on the children, and rightly so, but they flagged along with me, what else can we do to make sure that we're encapsulating a broader look at who may be at risk. So I think for us, we had a few different individuals. Our broader group on stakeholders also included all the hairdressing and barbers that wanted to be involved, and we actually did some cut it out sessions with those people to be able to help educate them and help them become engaged as navigators for some of their clients. They were able to actually do some referrals, which was wonderful, that first step. As well, dentists and doctor's office became critical in rural Alberta. Just, again, not just to put pamphlets there, not just to put our CCR executive summaries within their staffing rooms, but to actually have them participate in some training and some conversation with me along the way so that they felt really engaged in being able to be part of the CCR models, not just kind of an afterthought or a place to put literature. I'm going to move along to some success stories because I kind of can get carried away here. So I think it speaks a little bit to the differences in just the participants and how thinking outside the box along with our community advisory groups really helped to disseminate the awareness. That was critical, very, very critical. And so I'm going to tell three stories quickly. One is of the tow truck driver, not tow truck, snowplow. Snowplow, I guess he does tow truck in the summer. So, but this was winter for the county of Athabasca. He called me, a young man in his 20s who had heard the It's Not Right presentation and had been out to a very, when I say remote, I mean probably 45 minutes to an hour outside of the town itself. An elderly gentleman who always put a flag out to get his driveway cleared, and this young man hadn't seen the flag for a while, but he had noticed because we talked about this, eyes and ears, and what do you notice different? And you are a first step for people that may be at risk or in danger. And he noticed some new tracks going into that house. And I remember he talked to me about there are a few cars that were city cars. These were not cars that belonged out in the country. And he took that to me. We connected with the RCMP and decided to do together a welfare check out in that community under the guise of thefts that had happened in the community. Now, a key for our stakeholders group was to have the detachment commanders on our community advisory groups. Not to say that corporals or officers of the RCMP aren't very important, but to have the detachment commanders buy in and have a presence allowed me to then make a call down the road and say, I need your help here. I know it's not really maybe in your scope right now, but it would really, and they understood that. They said, we can do a welfare check under this guise. And so they knocked on the door and realized that he was off in a bedroom and there were a lot of young people there. And in fact, there was abuse happening in that situation. And in fact, that older gentleman had become a prisoner in his own home for quite a number of months. Another story was from Westlock. The senior center became quite active. I mean, they were champions. They were advocates of this program, and they held It's Not Right sessions. They held information sessions for me to come and talk to the public. And they said it benefited them because it got a lot of people into the senior center that maybe didn't know about all that they did in the community. And they referred, they would call me and they said, we've got a couple that come in. And we've noticed and they were in their, mid to later 80s, and they noticed that the female of the couple was losing a lot of weight and was starving when she came to the center and couldn't eat enough. And she was coming with her husband, and they kind of wondered now, is something going on there between the couple? Well, we connected with the PCN and Alberta Health Services, who were part of our community advisory group. And we were able to, because one of them had been hospitalized some time ago, but they were kind of, again, under a guise of, we're going to do outreach and check on you after your hospital stay. And we were able to go in and have a nice conversation and realize there was no abuse going on, but some capacity issues had happened. And the fridge was full of food, but they had lost the ability to cook and prepare food for themselves. And so literally the wife was starting to be quite malnourished. And with that came some mental capacity diminishment, and it was all around nutrition. And so that wasn't abuse, but it could have turned into something that, just the senior center flagging it and calling it. And, I think my favorite story, and I may have shared this before with some of my colleagues, is I went to do a It's Not Right presentation. I thought I was invited, and in fact I was, but when I got there, you wouldn't have known it. There was a group of 12 real staunch leaders in their community in a small area, a small community center, and they saw themselves and they were true leaders in their community. So when I did the It's Not Right presentation to them, there was a gentleman who sat cross-armed. I could tell he was really one of the leaders. He kept shaking his head saying, you know, this is not, those stats aren't us. This isn't true. This isn't what's being experienced in our community. And just to fast forward well, I knew I was in trouble because his wife gave me the look to say, you're on your own there. This is typical. So I knew, you know, like she just kind of gave me the look like, good luck with this guy. But at the end, he came up and he said, I get it now. You're not talking, you're not trying to tell me, you're not trying to tell us that we're abused. You're talking about our friends and neighbors. We're the lucky ones. We're the ones that are engaged. We're the ones that come to the center. You're talking about other people that we may know or not know. And I said, yeah, for sure. And so from that, he orchestrated, he said, what could we do? So we started, well, they did. I just was part of the discussion. They used to have dinners once a month, and they had kind of stopped doing that because of just age and energy and capacity, but they decided to start it up again. And more than that is they decided to keep a roster of who out of there was usually about 60 people, 70 that came to these community suppers. And they started to keep note of who wasn't there. And then they started to reach out and phone. And they phoned these people that weren't showing up. And what they found, we found 20 seniors in that community that had some kind of issue happen over that year that they were not aware of. A few had lost a spouse and hadn't stepped forward to say this had happened, and they were really isolated. A few had lost the capacity to drive. Some had some cognitive difficulties, so we were able to do some capacity connecting for some assessment and supports. But even those 20, from that, if you think of what would have happened if nothing would have connected them back to community, they may have ended up losing their space in their home or being, you know, brought into a hospital or an emergency. And so, you know, that was a wonderful story for me to see both the change in attitude, but also the engagement of these real staunch believers in their community and supporters of their friends and neighbors, and what they could do with just outreach and phoning and setting up a roster to drive. And that's continued to this day. So that's kind of it for me, and I'll take questions at the end and I'll pass it over to my colleague. Thank
Thank
you.
you. Thank you, Irene. I appreciate it so much. Great stories, and that's what we want to hear. We want to hear those stories. So now let's go right on to Debbie Posey, who is from the town of Okotoks. Debbie, take it away.
Hi, everybody. Thanks for having me on. I think we've done amazing things with our CCR. And I remember when the funding first came out, and Okotoks is quite a young community. And I knew that we had seniors in the region, and I have excellent relationships in our region with the other FCSS programs. So I regularly talk to Amanda and Shelley and some of our other FCSS folks in our area. And so I thought, well, before I, decide not to apply for that funding, maybe I'll check with some of our partners and just see. So I started with the RCMP, and the staff sergeant said, oh yeah, we definitely have elder abuse cases, and we definitely could use some help. And every single agency I spoke with said, oh yeah, we're seeing elder abuse. Oh, for sure, we're concerned about that. And like that, I had 9 letters of support from across the region. And so rather than just having it be an Okotoks specific CCR, we know that we're close geographically. We've got several towns all linked by the county foothills. in our geographic region. And we quite often need to do regional services because we have regional service providers. You know, we don't have an agency in Okotoks and one in High River. We have typically an agency that serves the whole area. And so off we went, we applied, we got the funding. At the time, I had a staff person who had just left and decided that she had her master's and she wanted to contract. And so I hired her as a contract using the CCR funding. And she had, you know, phenomenal relationships, I think, with Alberta seniors and with all the stakeholders because she had been a frontline social worker. And so she just understood what needed to happen to develop a really good coordinated community response model. And we worked together very hard to get the right people at the right level engaged on our steering committee because we knew that if we didn't have the people at the table who could commit the time and the decisions and the staff to participate, that it would take us a long time. You can do so much with frontline providers, but our experience was when we had tried to do backbone things before, or collaborative things before, we sometimes found that those bigger institutions like Alberta Health or the Primary Care Network, their staff would join for a while and then they would be pulled off. Their managers would pull them off because they had other priorities. And so we knew that if we didn't engage the right people at the right level who were decision makers that would commit to developing a coordinated community response model and stay engaged, that we wouldn't be able to continue. And so we've had phenomenal engagement right from the beginning. We've had laughter, we've had tears, we've developed a very strong working relationship. And in 2019, we had a very dynamic staff person on, and she said, yeah, we had talked quite a bit as a steering committee about engaging seniors to help kind of inform, touch base with what we're doing, make sure that our awareness materials were what we wanted, and that the seniors were engaged in that awareness piece as well. So, you know, we'd had all these things come together and we had some people trained on It's Not Right. And so we joked because she came back to me and she said, I'm gonna create a seniors advisory group. And I said, well, you should check with them because I don't think they're gonna like it if you call them SAG. And she said, oh yeah. So she went back to them and of course they all had a good laugh and ended up coming back with the Foothills Elder Advisory Group. So FIAG is what they were called. And they were this incredibly engaged group of seniors from right across the region. And they represented, you know, seniors clubs and retired professionals. And they worked really diligently. They revamped every single one of our brochures. They developed a toolkit, kind of an accordion fold out for people. And they went around and distributed, I think, something like over 5,000 information packages and engaged businesses right across the region to be aware of elder abuse and to have materials available. And so they're still quite engaged. Our steering committee partners have never changed. Our original partners were the RCMP, Victim Services, our housing provider, West Winds Communities, FCSS from across the foothills, so Foothills County, High River, Okotoks, Black Diamond, Turner Valley. The Calgary Rural Primary Care Network continues to be involved. Alberta Health Services, kind of at the higher level, and Alberta Health Services Home Care Social Work is very engaged. And they just come to the meetings. They come to the meetings. We review terms of reference. We talk about how the model is working. We talk about whether anything needs to be tweaked or changed. as we developed our CCR, because High River had been so impacted by flooding, they already had a group that met previously. They were called I forgot what they were called, a coordinated like regional response team, kind of is what we've called them. And so our coordinated regional response team is our frontline providers. And so they're the ones that come across elder abuse cases, that support our seniors, and they meet regularly as a group of frontline providers to support one another, make sure that our CCR is working well as we intended. And it's to the point where really, if they have something they're unsure about, they just pick up the phone. And sometimes, if they don't have consents to share information, they'll bring a bit of a case study. So kind of non-identifying information, and they'll either find a case from another community or they'll talk about a case that they're struggling with. I do remember they did get consents at one point, and they went to a CRRT meeting. And as the home care social workers started to talk, somebody else in the room said, "I'm dealing with that senior." And the home care social worker was dealing with the family, and the other agency was dealing with the senior. And the stories didn't mesh. As soon as they started talking about it, they realized, oh, okay, there is abuse happening here. And the family has reached out to try and kind of cover some things that are happening in the home. And the family's not coping well. So we need to maybe get in there and provide some support. So sometimes just having the collaboration happen makes a huge difference for people. I think the fact that we've kept the same group of very engaged service providers on our steering committee is really our success story. They're just our dream team, and it's to the point where it's quite seamless now. And where we struggle is with kind of that case management function where, we've got somebody volunteering to do our stats and keep records and keep us on track off the corner of her desk. So we're thrilled, to be looking down the road now to be able to hire someone to pull some of those pieces together. So, I think another success story for us would be, because we have our housing provider on board, a couple of times now when we've had seniors that are willing to leave the situation, but they don't want to leave our community. We have quite a rural feel here, even though Okotoks is half an hour from Calgary. It feels rural and it feels different here than a big city. And so we've been able to get respite beds. Our housing provider will find us a respite bed in one of our lodges for the senior to just kind of stay, get some support, decide what the next steps are. And that has been a huge bonus for us. So I think I'll end there. I can see time is ticking by here, but I do want to acknowledge the phenomenal support that we've had from Lori and some of the folks at Alberta Seniors, because without the models and without the, I don't know how many times we picked up the phone and said, can you help us with this? Or what do you think about this? And they're so wise and so helpful. So thank you, Lori, and your team.
Thank you, Debbie. I appreciate that great background there from our region. It's my peep there. So thank you. So now we'll move on to Teresa. Teresa Sutherland, please go ahead. Thank you.
Thank you, and thanks everybody for inviting me. We started off a little bit differently than some of the CCRs that we have presently. We've been around since 2006. And that occurred when the city of St. Albert did a needs study to find out what some of the gaps in services were for individuals. And at that particular time, they weren't looking at any specific age group. They were just looking at where was a gap in services and did the city need to intervene to help and provide things. And that needs study came out and clearly indicated that there was a real gap in services for protection and supports to seniors. And so at that time, what occurred was a group of individuals got together and they created, at that time we didn't even call it CCR. It was basically a collaboration or a group of individuals who we could go back and forth to. And that became started off with the RCMP, Victim Services, St. Albert Senior Center, Capital Health Geriatrics, Alberta Health Services Home Care, Sturgeon County Hospital, the PCN, and most recently we've added Community Village. And those individuals came together and said, well, we can provide services and we want to work together. So for the first year was spent mostly working on creating a memorandum of agreement. How are they going to participate? How could we share information? Because as we know, FOIP and all the our health standards and everything have very limited abilities to be able to share information. And so we came together, and I wasn't involved at that particular time, but talked about what can we do so that we can talk about these cases and we can share resources and we can build a stronger community. And the city of St. Albert provided the first funding. And within a short period of time, they realized that, great, we had all these wonderful, very talented people come to the forefront and say, yeah, we wanted to be involved. So we originally started working with the management end of it, or the leaders of those organizations. But we realized very quickly we needed to have frontline staff so that we could turn to them and say, okay, this is the situation. So the city of St. Albert provided sort of that first initial core funding that we were able to say, okay, and great, that's wonderful, but we also need somebody who will coordinate the case management, because it's great to identify an individual that may be in need, but who's going to follow through to make sure that all the organizations are aware of what's going on, and maybe to piggyback their services or to prevent that person from getting lost in the system. So that's sort of where it began. And we were fortunate enough at that point, we also needed the group needed a core agency to be sort of the administrator and also the person that provided the clinical supervision and support to the case manager. And that's where SAFE became involved. They had already been very much involved with abuse in the community because they have been around for 30 years and they have provided counseling, support for children, education, all of those things. So it seemed to be a really good fit, and it has always remained that way. So over the years, funding has always been a real big issue, though. It always seems like that we really get the pace going, and that we attract all these wonderful people who are willing to step up and continue to provide the services. But until recently, it was always piecemeal funding. And actually, that's how I came about with SAFE, is that they had their case manager or elder abuse coordinator, which is my position, had left, and they needed another one, but they only had funding for three more months. And they weren't prepared to just let that funding just go, and they wanted to continue to provide services. So I was fortunate enough to come in. I had retired, and the position became open, and I thought that sounded really good. I had started off my career at Windhouse, and I've always been very much involved with family violence, and it seemed very fitting for me to end my career working with seniors. So I applied for the position and got it. But what was more important was that I wasn't a young social worker. I had the ability to be able to say, okay, I'm just signing on for 3 months. Well, 3 months became 6 months. 6 months became 9 months. 9 months became a year. Now we have funding until next year, because slowly but surely, I think what's been happening is that we're really understanding that elder abuse is a real issue. We're getting people to listen. We're getting the government to listen. This pandemic has been an eye-opener for all of us. And so I think that's been a great, a wonderful thing. And I really encourage and want us to keep moving in that position, for us to advocate, to educate, get out in our communities. And that's a lot of what I do, is I provide educational opportunities. We go out and we provide, right now we're providing Zoom sessions. We just did one on personal directives, powers of attorneys, and other forms that you may need as you age, because people know sort of what they're about, but don't have the greatest understanding, and how easily those things can be manipulated. So we've just done a big workshop on that. Tomorrow night, we're doing one on frauds and scams, but not just frauds and scams, but how can the bank also help you to protect you? So, you know, if you're hiring a contractor, what can they do to help protect you? What if you need just the boy down the street to cut your lawn, and you have to pay him, and you're really, you know, you're housebound? How can we get a systems put up in the with the bank so that that can be done, and nobody can really get a hold of your bank card or manipulate your funding? Also, what if somebody shows up at the bank who you've approved to have withdraw some funds, but they're starting to withdraw some excess of money? So that's really what our next workshop is on. And we're going to do more and more of those things, just to educate the community, not only the seniors, but other people around them, to go, I hadn't thought about that. Maybe I should talk to my mom and dad. Maybe I should talk to my neighbor. Maybe I should keep an eye out. So we, you know, that's basically how we started. We have been very fortunate. We, from there, we also created a very strong memorandum of agreement that we stated, okay, if you're going to be part of this organization and this committee, what are your commitments? How often are you going to be committed to come see? What if you can't make it? Will you send somebody else from your organization, so that the flow of information could be concise, and it could be continual? So we did that. We did that with the RCMP, with the RCMP Victim Services, the St. Albert Senior Center, all of those that I talked about before. You know, they've all committed that they will come once a month to meet with me, and we'll sit down and we'll talk about cases, those really complex cases that, you know, you need to have somewhat more ears and eyes, some other ideas, because some of these cases can be really complex. You know, maybe it sounds like abuse, but you really don't know. So, of course, when I meet with somebody, one of the first things I do is I talk to them about our committee and how it works. And can I talk openly? Can I use your name? Some people say yes, some people say no. If they say yes, you know, I have them sign or agree to release some information. You know, if they're not prepared to do that, and say, well, I'm only prepared to do that with home care. I'm not very comfortable with the RCMP becoming involved at this point. Then we will only work with that individual group. So it's been a real give and take. And it's wonderful to see how we also make referrals back and forth. You know, there's been a number of times that the Sturgeon Hospital will call and say, we've got a case here that we think is abuse, but that person is being discharged right away. Can you pick it up? And that's exciting, you know. And I'm going to talk a little bit about one case, and that really was an eye-opener for me. I hadn't been with the organization for very long, and we'll just call this individual Frank. But I got a phone call from the social worker from the Sturgeon Hospital and saying, you know, I'm really concerned about this individual. He's pretty nonverbal. He has very poor mobility issues. And he indicated to me that his caregiver was slapping him and calling him names, and he didn't want to go back home. But we had no choice. We had to discharge him. So I didn't know what to do at first, you know, because you can't go basically into somebody's home. So, and he was nonverbal. So I contacted our representative on our collaboration team, and with the RCMP, and said, hey, can you do a wellness check for me? Can you have a member go out and check on this individual? By that time, we had also heard that the caregiver was going out every Tuesday night, and they were going to karaoke and having drinking. And so I said, could you go out Tuesday night and see who this person is left with? And sure enough, that one of the Tuesday nights, the RCMP went out, knocked on the door, and nobody answered. The house looks very quiet. And I got this phone call and said, nobody lives there, or nobody's home. And I said, well, there'll be somebody at home, because this person's pretty his mobility is poor, and he's just gotten out of the hospital. A few minutes later, I get a phone call back and said, we bumped into the home care nurse. She's going in to do meds for the night. She has some concerns too. So she let me into the home. When they got into the home, they realized this individual was living downstairs where he had to climb several stairs to get up into the kitchen area. He had no grips or anything for when if you were having a shower or a bath. There was no lift on his toilet. He was quite concerned that he was being left alone. So the RCMP contacted the caregiver and said, hey, where are you? This person shouldn't be left alone. There was nothing criminal that they could do. But the police officer said, you know, I'm not comfortable with what's going on here. So the next day, you know, once we had the chat, and then I talked to home care. I said, well, can you review your staff's notes and messages and see if there's anything there of concern? And sure enough, came back really quickly that they were concerned about this person's nutritional intake. He had swallowing problems, and he wasn't being given the appropriate foods for him to swallow. He was basically told that he could eat anything out of the fridge, but nothing. He was choking on them because it wasn't things like soups or purees or things like that. And it was becoming malnourished. So eventually what happened was I spoke to the caregiver and said, look, you know, I'm really concerned. I'm concerned that one of these days when you're not home, you're going to find that he tries to get out of the house and he's going to freeze outside. And the caregiver actually said, you know, he won't go far. We'll find him right away. We were horrified. Sure enough, a few weeks later, I got a phone call from the RCMP again. He had been found outside. He was luckily not injured, but again, his mobility was poor. He was placed in hospital because the paramedics said, you know, there are some major concerns here. So eventually we were able to have the public guardian become involved because his own guardian wasn't taking the role and responsibilities that he was supposed to be taking. And the public guardian spoke to the guardian and said, look, you know, these are the roles and responsibility. And he kept saying, but the caregiver is a good caregiver. Well, it turns out that caregiver had been had a licensed care home, but that license had been removed because of accusations of attempt. It used to have 6 adults living in it. Now there was only 2. The long story is that this individual stayed in the hospital because we negotiated with the hospital through home care and ourselves and saying, he can't be released to that home. We have to figure out another answer for him. And so with some chatting back and forth with the caregiver, having the police give the caregiver and the legal guardian talking to the legal guardian, finally said, no, I don't think he can be returned to that home. And he was moved into a care facility, and he's been doing extremely well. I have no doubt that that group of individuals saved this man's life. And my job was simply to get everybody thinking about what is that individual needs, what is going on here. How do we do it so that we can work together? You know, so that's really, for me, is the primary benefit of having a CCR, is that it's a group of people looking at options and solutions to some incredibly difficult positions. We had another one where the neighbors called. Their neighbor had been left widowed, and shortly after her sons had come together and moved her out of her home. And they were really concerned. They had heard about neighbors, friends, and family, and said, you know, well, what can we do? And I said, well, you know, you did the right thing. The first thing you did was call us. So again, you know, they were concerned because the 2 sons that they had, their interactions had been very bullyish, and they seemed to be bossing their mom around. And so again, the RCMP said, hey, you know, we're willing to give them a phone call. So the RCMP phoned, and she was at home living in her new home with her 2 sons, and she was sitting on the deck, and she was having a wonderful time. She said it was so nice to have her sons nearby. There wasn't any issues. She was really flattered that her neighbors had called. Matter of fact, that she was sitting on the deck right now watching the birds, the bird feeder that her sons had put up so she could see them. And then the one thing that she said was, the only thing is I don't go off the deck at night because there's coyotes. So, you know, just that brief conversation took away the fears that the neighborhood had, and at the same time gave us an opportunity to check on someone who may not have been getting services and supports. That's really what it's about. For us, we do a lot of public education. We go out whenever it's seniors week and we do sessions. Anytime there's a seniors expo, we go out and make a presentation. We've often been called to senior centers, or the lodges will call us, or some of the private agencies, and said, what do you really do? And so we go out and educate and educate and educate. What are the things to look for? What are, we work closely with the pharmacists, when someone is getting their medication and, they're stretching it out for a long period of time, what's going on there? We had another situation where the hospital social worker was in the point where she had to move an individual into long-term care. So they always look at their last 60 days of bank transitions. Got a phone call and said, Teresa, can you come down to the hospital? We're concerned that her transactions are a little off here, and it's her son-in-law has power of attorney. When I looked at the transactions, it was clear that this man was borrowing using $3,000 or $4,000 a week of her finances, and there was hardly anything left. Nobody had talked to the woman about that because they didn't want to stress her. But the reality was that she was going to be moving into a different level of care home that she wanted to be in because there wasn't enough funds. So I sat down with her and said, do you mind if I ask you some questions? And she was absolutely lovely. And she said, no, not at all. And I said, have you seen your bank statements in the last little while? And she goes, no, I leave that up to my son-in-law. I have no other family member. He takes care of me. And she says, I trust him because he took care of my daughter till the end of her life. She had cancer, so I know he'll take care of me. It sounded reasonable. And I said, well, how about if we look at your bank statements together? And she goes, oh, I'd like to do that. She says, I used to be a bookkeeper, so I'm good with numbers. When I showed her bank statements and said, can you tell me why this person would have spent $300 at this restaurant and then $300 again at the same restaurant just 2 days later? She was horrified. Her entire life savings had been dwindled down to just a few $1,000s. She said, I don't understand. I don't know what's going on. So I said, do you mind if I have a police officer come talk to you? And she said, he's taking care of me. I said, do you mind? And she said, oh, no, not at all. And this woman was 90 years old, had been in the hospital for quite some time. She had been a widow for many, many years. And she laughs and she says, can you tell me if it's going to be a male police officer or a female police officer? And I said, I don't know. And she goes, well, I hope it's a male because then I'll brush my hair and I'll make myself look pretty. And we just had a good laugh together. And sure enough, she confronted her son-in-law and said, where is my money going? And he knew he was the only individual in her will. And he says, I'm going to get the money anyhow. There was nothing that the police could do to charge him because she had signed out off the power of attorney. But, the police talked to her and said, she's not dead yet. And so she ended up going into a different type of long-term care than she wanted to, because her life savings had been spent on a gambling addiction. Oh, and again, here people had basically written her off because she was old, that she didn't understand, and she didn't even know what was going on. And sometimes we need to take that time and just explain to someone. So, and all of those come back to having those strong relationships where we can pick up the phone and say to home care, look, I have this situation. Do you work with this individual? Or to the RCMP, can you do a wellness check? Or, we have someone whose cognitive abilities seem to be floundering, then I call a partners with Covenant Health, who goes out and can do a cognitive assessment for us to get a better sense of what's going on. That one has been a godsend because we have had so many individuals that their fellow members in their apartment building are saying, oh, something is really wrong. She doesn't seem to be taking her medication. Another one was wandering around in her nightgown at night. Well, nobody was checking on them. And nobody realized that they weren't taking their medications appropriately. Not only they were not, but they didn't know how to take them medications, and we're getting confused, and we're taking their sleeping pills during the day and being awake all night, so we're wandering. And so then you're getting home care involved. So it's building all those relationships so that we can protect and allow an individual to stay in their home for as long as they can, for them to be able to have the best life that they can, to have individuals who may be abusing them removed from their home life, or given the opportunity for them to make the decisions. Like I say, this 9-year-old woman, her son-in-law was the only person that would care for her. She loved him, but she didn't want all her money gone. Sadly, the one part that broke my heart was a few months after she moved into long-term care, she died of COVID. And I always think about it, how horrible to know that your whole life savings was gone by someone you trusted and you had just found out. And so for me, it's more than that. It's building those relationships, telling the individual, working with the individual so that they feel empowered to make decisions, to help them move an individual out of their home who may be not paying the rent, not helping with food, yelling at them, all those type of things. We often get those cases. Building a safety plan for them so that they know that, if their son is living with them and they escalate, how can they protect themselves? Where do they go? What do they need? Who do they turn to? Having the police come in once in a while and checking on them, having their home care increased. That all happens because we have close relationships with all those organizations, and we can build on services. That's what a CCR is about. And I think it's such an amazing way to provide services to an individual. And what we need to continue to do is do that. But more importantly, we need to have the sustainable funding in the long term so that we're not always having to piecemeal. Because if I had been a young social worker who had to maybe support my family or anything, I wouldn't have stuck around after 3 months at a time. You're looking for long-term jobs. We need to make sure that the funds are in place, stay in place, so that organizations can continue to provide the services. Thank you.
Thank you so
Any
much, Teresa.
And I guess I'll answer questions. Yeah, and I'll answer any questions at the end as well.
Thank you, Teresa. I really appreciate it. So finally, we have Colleen Lewis, who will be, she does have a few slides, but she will be speaking for the town of Sylvan Lake for Brittany Wells. So Colleen, take it away.
Super, thank you very much. And thank you for the presenters before me. We have lots of similarities as we followed the same grant model, but so many differences and uniquenesses. And something I'd like to share right at the start is I had the opportunity, the honor, the pleasure, the opportunity to start CCRs in 3 communities. So I began in Hanna in 2015. And then Sylvan Lake in November of 2016. And I went back and forth between the 2 communities. And then in 2018, I moved to Medicine Hat and started the CCR there. So it has been a tremendous time of growth. And that is part of the joy of seeing a project, not to the end because it's not going to end, but to see this project through, and the growth and development of all the CCRs across Alberta has been excellent. So back in 2016, Sylvan Lake was supported by their FCSS. They wrote the grant, and that opened a tremendous number of doors for me in the community. It was super important to have them on board. Mayor Sean McIntyre was amazing. And he showed through his leadership how important this was. And because of his engagement with the CCR, more people were open to me when I knocked on their doors. And that was important to do that one-on-one piece, that engagement to bring people on board. And so he helped right from the beginning, being an active member of our committee, and he continues to advocate for elder abuse awareness, prevention, intervention, and that is crucial. Who you have on your committee has been mentioned. I know Teresa had said, or maybe it was Debbie who had said the right people at the right level. It's all of us are aware of that. And the Senior Center, RCMP, pastors, victim services, older adults, PCN, family counselors, banks, long-term care representatives, were all super important to have on our CCR. One of the benefits of being with Sylvan Lake was they had started with Innisfil a regional vision for nonviolence, and they focused on family violence prevention and training. And because elder abuse falls under that umbrella, I was able to further the elder abuse prevention through all of these communities. So they began with 13, they're up to 16. The first original 13 there are listed. I believe it has been Penhold and Three Hills who have joined, and sundry. Three Hills, and we created lots of resources as well, but Three Hills hosted the Seniors Week, and it was super exciting to see that they were using our banner that we had made, the one that sits on the floor and it's nice and purple and had all the information. So it was good to see that that was continuing to be used. The Mayoralty was something that was created to engage the mayors. Because of Mayor Sean McIntyre's involvement, we were able to send invitations from him to all the mayors so that they realized the importance of it and they were willing to engage with us. So we had them each year come to a special event where they heard about their community. I think I might have that on the second slide. They heard specifically about their community and the good things that were happening in their community. And the people that were frontline workers or general members of the coalition had an opportunity to go up and speak to their mayors about their concerns and be heard. It was super powerful. And we took pictures, we had media, we did the full coverage to show the importance so that it was known in the community as well. The Centers for Positive Relationships were established in each of those communities. Elder abuse information was absolutely included. Most of it was books, videos, and brochures. Most communities put this information in their libraries, so it was easy accessible, and you wouldn't know that somebody was being abused. Like it didn't identify you as being a victim of family violence. When it's called a Center for Positive Relationship, it was very welcoming and non-threatening. So that was important, that we wanted people to be able to take out these resources or come and read them in the library, whatever worked for them. Today, the Regional Vision for Nonviolent Coalition is working provincially with Impact, planning their 7th annual Creating a Vision for Nonviolence conference on November 12th. And it does include an elder abuse component. They will be doing It's Not Right, Family, Friends, and Neighbors presentation. If you want information on that, last year they did it virtually. This year they're hoping to hold it in person by November, but they may do virtually as well. Their website is www.visionfornonviolence.weebly.com. And it does also have recorded past Mayor's Trees interviews as well. What else can I wrap up with? I think I've covered all my points. I wanted to thank Lori as well for her tremendous support. All 3 communities, whatever questions you have, she was willing to answer and help you work through issues or concerns. And to Chantelle as well for your leadership in Medicine Hat with the CCR there. That has been invaluable. Thank you.
Thank you so much, Colleen. I really appreciate it. So we'll get right on to Lori Therian from the Minister of Seniors, the Ministry, pardon me, of Seniors and Housing. Lori, did you want to take it away?
Sure, thank you, and good morning, everyone. I'm so excited. I've had goosebumps throughout listening to all of the wonderful work and really the mobilizing of community, the grassroots initiatives. It's very overwhelming. So thank you for all your efforts out there. It really does make a big difference. Now, for many of you, you might have heard my analogy around the iceberg theory. And today, what I'm hearing from all of you is that underneath the ground or underneath the water, great things have happened over since 2015 and for some before that, of building relationships, building the tools, like I've heard terms of reference, I heard a memorandum of understanding today, and many other tools that people have used, and recognizing the importance of collaboration. And that's what really was this whole image of creating a coordinated community response. The toolkit that is up here really walked us through a community development process that you could apply to any social issue or any community practice effort in designing something, which is really starting that conversation, gathering the right people at the table, developing those guiding tools, those visions and mission statements and logic models, and really what you've talked about today is about everybody in your community knowing that they have a role, knowing how they can participate, knowing how they can be engaged. It's just heartwarming to hear these messages, how you've communicated out with your CCRs, um, and and having strategies around raising awareness and communicating amongst each other. I heard today from you about consultation on cases with service providers, figuring out how to be able to share information, and those light bulb moments where making a difference by sharing bystander training with community groups and folks sort of knowing what to look for, those red flags. Well done. Um, it really is about many eyes are on the neighborhood, many eyes are on the community. Um, Many voices can happen to make a difference for our communities. Here is this toolkit that we designed here based on learnings from the development of these wonderful CCRs. Way back in 2012, there was about 7 different areas of the province or groups that had interagency meetings or coordination for events or different things happening. There was a few that had some of these grassroots materials to help lead the community. And what was exciting when I was learning about all of this is that there was some great work happening out there in Alberta, but it was really based on a project or an event or a something that had to occur or was going to occur in the community. And then people would sort of lose steam, or people might retire or move jobs, and then what? And so giving it a lot of thought about what could help us was really this business plan. And what stayed alive in communities really seems to be a sense of buy-in to a business plan or a business approach. So really that's what the CCR toolkit's about. It has a circular vision where there's no beginning and no end. There's moments of time where we do different things. And the really key important stage is number 5, where we really look at stopping at some point. Maybe it's annually, maybe it's like whatever point in time you decide on, to really look back and say, okay, what have we accomplished? What's working? What isn't? What do we need to change? Who could we engage further? Let's celebrate what we've done, and really talk about where we go again. And you may be back into starting the process with some organizations because people have retired or moved on to other jobs or different change in leadership or whatever it might be. So the next slide, please. So really the toolkit is on the website. You can access it, go back to it, check it out. But what I'd really like to spend a little bit of time with you today is to say government, seniors and housing, has taken a step back last fall and into the winter here and really wanted to say, okay, we spent $3.6 million on developing coordinated community response groups to support that in 31 communities or organizations across Alberta between 2015 and 2018. So how do we know it worked? How do we know that we invested dollars in the right way? And so we did an analysis of the grant program through all the great reports that came back throughout the 3-year duration of that grant. And we learned that tools were being created by CCRs, and that was really about developing what was under the water, with the iceberg in order to keep it afloat. And so there was lots of things like you'll see here in the middle of the screen where it talks about tracking templates and risk management tools and reporting and tracking tools, safety planning, interview or questions, how files were going to be managed and closed, and consent forms. So these were sort of some of the highlights that were most common in the grant program of what people were developing. You'll also see down below where it says the CCR toolkit, 2/3 of the survey respondents indicated that the toolkit was helpful to mobilize their community in developing a framework to prevent and address elder abuse. We had a few people that the survey came back from that really spoke about wanting to use it as an educational component in universities or within post-secondary education. So it was a bit different for some. We do know that CCR toolkit has been utilized in other countries and at different provinces in Canada as well, like I mentioned, within post-secondary groups. So it was released in 2019 following the grant program as a real opportunity to say this type of community development works. And this is what we know about it and how to put it together. And then you'll see, I've just got to move my screen a little bit so I can see it. You can see that we did a survey, and thank you all for participating or whoever did. We did a survey this past year looking at, with the 31 existing CCR groups, what did you think about this whole process? Well, 98% recommend that other communities develop and implement a CCR. 95% felt that CCR model impacted elder abuse prevention in their community. So designing something made a difference. 91% said collaboration was viewed as an effective way of addressing elder abuse. So another very interesting perspective around collaboration and the meaning behind it, and the fact that we know elder abuse is a complex issue needing a complex response. 86% currently focused on raising awareness. So this was 2 years following the grant program closure of 2018. CCRs were still able to do something in the sense of raising awareness. We know that there has been gaps in funding for sure. And we know that we've been going through a really tough year with the pandemic, and yet we were still raising awareness. We were still drawn to helping our folks out there in community, wherever they may be. 75% of the CCR model influenced or changed the community collaboration. So perhaps that's in the senior sector. I'm not sure, but really good results we could see throughout the different things that we did. So we did a survey with the CCR toolkit and a survey with the CCR evaluation with the existing 31 CCRs. You'll also see some messaging. These were sort of some quotes that we took out of the survey. The surveys were done anonymously, sorry, can't think of the right word. Nobody knew who was responding. So I don't know if this could be your your response. I don't know, but so we just took out some really key, interesting comments that people were making about the difference that this is. One of the questions that we did ask was about, did you feel that this might be a coordinated community response, a promising practice? And we had an overwhelming result of yes, of positive about yes. They believe that not only is it recommended, but it is a promising practice in our province. So I wanted to share with you some of these results. As I mentioned, between 2020 and 2021, we've done this evaluation of the CCR model. This past winter, as you know, towards spring here, the government has provided $750,000 over 2 years to the Alberta Elder Abuse Awareness Council to support case management. So part of it is due to the fact of these wonderful results. Part of it is due to the fact that during the pandemic, unfortunately, we were hearing in government that for some communities, they were seeing perhaps maybe not more cases of elder abuse, but more severity. As well, we did hear from some communities where they are saying, yes, there was more abuse occurring. We do know that as well within family violence, we were also seeing numbers changing as well. Maybe not as many people going to shelters and really staying home due to the pandemic. So fear of the pandemic or fear of the abuse, really challenging times. I just want to say on a personal level is that I really want to honor all of you for your dedication, your commitment to older adults and the safety and well-being. And I really want to give kudos as well to the Alberta Elder Abuse Awareness Council for bringing It's Not Right to our province in mentorship, in the work that they're doing, in trying to get it more aware across the province. There's been lots of discussions internally with government, even about this type of approach to prevention. And as many of you know and have been engaged in already now this past week with us, with Seniors and Housing, as we move towards the next steps of government to address family violence, in particular elder abuse. We started with our engagement towards elder abuse, perhaps legislation or potential legislation. So we're hearing you. I just want you to know that government is hearing you, all of you, and we are making steps. It may seem very slow from outside looking in. Inside, I feel like I'm on a treadmill, but I just want to thank you again so much. So with that, I would really be honored to introduce Chantelle Ottenbreit, with the chair of the Alberta Elder Abuse Awareness Council. I think I called you a network, sorry, a council. You can see how far back I go. And with that, Chantelle, take it away.
Thanks so much, Lori. Cindy, if you don't mind to go to the next slide, that would be great. So I get to speak a little bit today about our Alberta Elder Abuse Awareness Council taking action against elder abuse case management funding, which is the new funding that Lori had just mentioned. That is the one-time funding that's been provided through the government of Alberta's, I think it's catching, Ministry of Seniors and Housing. And so the aim of this funding is really just to harness the power of these existing CCRs to be able to provide response services through case management to address elder abuse in communities throughout Alberta. And so as part of this funding call, it was a prerequisite that those who are applying were connected to an already existing CCR. And the point of that was really because we valued as well as recognized, along with the Alberta government, the work that had already go into establishing these CCRs and to making those connections and to building those relationships and to creating those different tools, and that collaborative model that already has existing relationships that allows for then therefore a case manager to come in and not have to do all that setting up of those relationships and establishing who their partners are going to be in this work. So we felt like that was a really important piece to have already in place before we could move forward. And so this is kind of that next step of taking what has been established through the CCR funding into case management, because we recognize that in communities, it's important to be able to raise awareness and establish those partnerships and work together to be able to address elder abuse. But we also need to have frontline services available for when people identify, yeah, I am experiencing elder abuse. Now what? What are those services? So this case management funding will allow us to be able to do that. And it will help us to be able to kind of approach it in a standardized way so that we have some very clear steps involved, some training, as well as some statistic gathering and things like that. So as you can see here, $650,000 is being provided to about 16 communities, regions, or First Nations. And the blue dots on the map kind of represent the areas that they're going to be covering. It's not exact, but several of them are regional. And so we try to make the area that they're covering a little bit larger, or some of the First Nations cover a larger geographical area. So there is pretty good coverage throughout the province. And I think it's a great starting place to be able to work from and build from. The next steps of this funding project are going to be, as I mentioned, establishing that case management standardized process. So we've identified several key elements, and we have established as well a staff person with the Alberta Elder Abuse Awareness Council, who is Joanne Blinko, and she's also on the Zoom call today. And she's going to be working with those different communities to ensure that they have these pieces in place. We really want them to be standardized, but not to be prescriptive. So again, just working with those communities to say, these are the important pieces that we recognize we need to have in place to do good case management. If you already have tools that you're working with, if you already have processes in place, that's great. If you need some support to be able to develop those, then we're going to be able to provide some training to that as well. There's going to be training happening on these key elements, as well as there's going to be some other training happening in fields and areas that are kind of connected, and also that will be in relationship to this core elder abuse group. So things like the upcoming Clare's Law presentation, for example, would be a great one. Or there's a whole host of different things around definition of elder abuse, family violence continuum, trauma informed, all those kind of things. Another piece of this funding will be about building relationships. So Joanne's very focused on connecting with those CCRs, the applicants, and the communities they represent, as well as being able to create a community of practice for case managers and providing support to those applicants. Because as part of this funding, we also built in some sustainability pieces. So working with the applicants to be able to develop their own sustainability model and looking to assist them in identifying where funding might be available and sharing funding opportunities, so that hopefully we'll be able to find some sustainable dollars to be able to assist communities in securing that so that they have the services ongoing, as this funding is one time for 12 months. So our goal in that time is really to be working with communities to identify those sustainable dollars. And then data collection. That's a really large area, and it's one that we recognize we're not going to do perfectly through this funding, but it's going to give us a good start, hopefully, in being able to set a bit of a baseline of what's happening for communities and hearing from them around what some of those outcomes are, as well as some of the statistics on outputs and things like that. So we've been working with a data collection person to be able to develop some new tools that we'll be using with the case managers, and we're really looking forward to the information that's going to come from that. And then finally, Joanne's also going to be working on some other key pieces of work with the council that are going to involve some of these CCRs and the communities that have the funding. So things like working with some of the key partners throughout the province to develop stronger relationships and identify new collaborations. We have some target areas that we want to move in and kind of develop further and work collaboratively with other provincial organizations in. We also want to be part of a national elder abuse strategy that's just started up. We're going to continue to take part in some of the collective impact work that's being done with domestic and sexual violence, and participating in discussions both provincially and federally about the definition and legislation pieces. Our goal really in this whole funding is to support the work that is going on in communities and to help increase the capacity of CCRs and communities to be able to respond and support seniors. And so some of our next steps in a practical side of this funding piece is that the successful applicants have been identified. The contracts are just being processed right now. And so funding will be going out in the next month here to the communities. And then we'll be moving forward with the connections to those and starting up a community of practice and being able to support communities to actually get in place their case manager and start that process. So we feel like it's a really exciting next step in this whole provincial movement around being able to address and support elders through elder abuse and helping to keep them safe, and also helping communities to be able to do that important work. So that's a little bit of an update, I guess, from the Alberta Elder Abuse Awareness Council side of things. We will also continue to, as Laurie mentioned, be working on the It's Not Right Neighbors, Friends and Family piece. We're looking at doing some additional training, as well as staying involved with CORE Alberta to be able to assist with some of these different training opportunities and things like that. So if you have any other questions, though, I'd be happy to answer those. And if you want to reach out to us, please feel free to do so. I'll put our email address in the chat box after as well. So thank you for your time today. Amanda, back to you.
Thank you so much, Chantelle, and thank you to everybody. I know we've run a little bit over, and so I thank you all for sticking around. This pretty much, if you do have any comments or questions, you're welcome to put them in the chat box. I know we've run out of time, but you are welcome to send an email to the email address that Chantelle just put up. And also just to let you know, the recording will be available on the CORE website and you will receive an email. So two important things is, join our CORE group here if you haven't already. And if you have any questions or comments, you're welcome to email Chantelle or at the info address, or to just join the group and where we can start a conversation. So again, thank you for sticking around. Thank you to all our panelists and to all our presenters. It was great. Really appreciate those stories and sharing the celebration of what's been done. We got lots of work, I think. We've done lots of work, but we've also got lots of work to go forward. So thank you, everybody. Take care. Bye for now.